Did you give me cat? So we have some patellofemoral dysfunction, whether or not it's just maltracking or if it's jumper's knee or whatever it may be. This technique works pretty good. So any pain around the knee, I'm going to show you the full lift. You can do any combination of this. So you can pull it superiorly or medial-laterally, or any one of combination of those. So I'm going to show you all of them and what it should look like. Basically, what we're trying to do is just control the kneecap within the femoral groove. Some of this is a little bit from Dr. McConnell, so that's okay. We can steal her ideas, I think. So pre-tough skin. Shh. He didn't want tough skin. You want to slightly bend the knee, so right in there, so you can see the kneecap set up above. If you go too flat, you can get a lot of play, but you can't see the apex. So you want to give it just a slight bend so you can see the apex. You're going to tear in the middle and fold your ends. Once again, try not to touch too much tape. The trick here, once again, is to use uniformity in your stretch. This is another strapping technique, so it's going to be full stretch or full tension. You're going to catch just the tip or the apex, like that, and you're going to actually just push superiorly on them and go ahead and bend your knee. Let their bend kind of take that tape up and finish off the stretch for you. And then no tension on your ends, like that. And if I did it right, it should have a bit of a wrinkle, and we got a bit of a wrinkle. So slightly bend your knee again, just so I can catch the lateral border of the patella. Once again, tear your tape in the middle. You're gonna fold your ends around, making it look easy. And you're gonna scoop it towards you. Try not to lift up because you don't want to tip the patella, you just want to glide it medially. So I'm gonna glide. Okay, bend your knee slowly, thank you. Good. And that just helps because he's going to bend his knee in motion so when he plays. So by applying the tape and more flexion, it's going to make it more comfortable for him and control the kneecap just a little bit more. So we've added a little bit more. Obviously, we're pushing a lot of skin around, but we're going to get a little bit of the bone too. Normally, I would come around the table and pull, but you can do it with a push technique too. Same tape tear, same grip with the tape, and you're going to catch the medial border. Snug it over, go ahead and bend your knee. And that's how I control the patella and the femoral groove. And it seems to work pretty good, and we get this little volcano looking